discussing a report, or the implementation of a report, into the abuse and neglect of children on a day where we've heard horror stories, albeit horror stories with happy endings, about the neglect or negligence of the HSE towards unborn children and their mothers. It's unbelievable that this House does not have the opportunity to discuss this matter today. It's even worse that the Minister for Health has not made any statement on this, or tried to put the minds of I don't know how many women and indeed their partners who have suffered the tragedy of miscarriage, who are wondering, should they have gone for a second opinion? Should they have been more forceful or asked more questions? Hopefully the cases we've heard about today are isolated cases, but the silence of those with the political and professional responsibility for our health service is deafening. How many more question marks are going to hang over the HSE before we finally have an effective and safe health service? How many more crises will emerge? At the very least, the Minister for Health should make time today to make a statement to the House and indeed to the public on this matter. We have discussed the past so often, particularly in terms of child protection, that I still sometimes wonder, what we have learned. But it is important that we have the chance here today to debate what will change and when we will see that change. At least there is finally a plan, but I do share my colleagues' concerns about the HSE's ability to implement it. The Minister claims that the system is not broken beyond repair, but we are a very long, long way from being the envy of every country in the world, as the Minister began in his opening remarks. I know and have seen it firsthand, like many others, the hard work done by individual social workers, public health nurses and others involved in the care of young people. Yet, despite the enormous and underestimated pressure social workers are under, you've only filled 25 of 200 places promised this year.